let's see something about hemothorax. Introduction. Hemothorax is usually a consequence of occurs due to a blunt or penetrating trauma, and it's much less common, and it may be even caused due to after open heart surgery or may develop spontaneously. What is hemothorax? So hemothorax is accumulation of blood in the intrapleural space and mainly found with open pneumothorax, and it's also called as hemopneumothorax, blood in the thorax. Coming to the causes, so damaged blood vessel in the lungs cause blood to enter the pleural cavity, and the cause of blood vessel damage mainly it's caused due to major injury to the chest, that is as a result of blunt force trauma injury, and it happens when there is a chest experiences a sudden and intense impact, mainly falling hard on the front of the body or getting in a car accident. The patient also not wearing the seat belt, and like the steering wheel or a deployed airbag hits the chest extremely hard, and even it may be caused due to a result of any thoracic surgery or pulmonary infarction. And these injuries, what it will do, it will be damaging the chest wall, lungs, and even the major blood vessels which are around the chest. And it causes blood to leak into the chest cavity and put more pressure on the lungs. So as a result, there is a cut or stab in the chest causes blood to leak into the chest cavity, finally leads to hemothorax. And the hemothorax also commonly happens as a complication of major heart or lung surgery. So here the surgeon requires to open the chest wall, and blood can leak into the chest cavity in the blood that does not clot properly after the surgeon closes the incision. So what it does, if an organ or vessel is cut open and leaks blood. Introduction. Hemothorax is usually a consequence of occurs due to a blunt or penetrating trauma, and it's much less common, and it may be even caused due to after open heart surgery or may develop spontaneously. Coming to the risk factors, hemothorax is usually the result of any accident or any traumatic injury that can be difficult to prevent in many cases. So, and in risk factors also cause, that is the surgery, effect of surgery, the people those who underwent any major surgeries like open heart surgery or even lung transplant may be likely to experience hemothorax. And here the doctors has to monitor this type of patients during and after surgery for any signs of blood or liquid in the lungs. And even the repetitive injury, so that the hemothorax may be caused due to any blunt force, or even the people those who are taking part in athletic activities such as football, martial arts and boxing. So these are the people at higher risk of developing the hemothorax due to the sport injuries, any repetitive blunt impact to the chest, abdomen or shoulders. Coming to the symptoms of hemothorax. The symptoms, mainly the person will be feeling pain or heaviness in the chest, and they will be feeling so anxious or nervous, and there will be difficulty in breathing, and even the patient may have trouble breathing and breathing quickly and fast heartbeat. The tachycardia will be there, the heart rate will be above 100 beats per minute, and breaking out in cold sweats, and skin will turn into pale, and there will be an hypopyrexia. The temperature will be above 100 degree Fahrenheit. And the large vein torn open when a catheter is inserted, while patient tissue around the lungs dying called pulmonary infarction, and even the patient may feel, and the pulmonary infarction because it doesn't have the adequate blood flow, and the patient even have the Ehlers-Danlos syndrome. It's a condition that you can see the diagram, it will be loosening the connective tissue. It will be highly affecting the connective tissue. And how is hemothorax diagnosed? So, careful history may be give clues to the cause and presence of hemothorax, such as chest trauma or chest surgery. And in other side affected lungs, sound also may minimize the people that are having hemothorax. Introduction. Hemothorax is usually constitutes of acoustic blend or penetrating trauma, and it's much less common, and it may be even caused due to after open heart surgery or may develop spontaneously. And even the repetitive injury, so that the hemothorax may be caused due to any blunt force, or even the people those who are taking part in athletic activities such as football, martial arts and boxing. So these are the people at higher risk of developing the and ultrasound in emerging situation. Ultrasound images we can provide a quick and accurate look in the pleural space for potential damage and hemothorax. And the large vein torn open when a catheter is inserted while patient tissue around the lungs dying called pulmonary infarction. And even the patient may feel, and the pulmonary infarction because doesn't have the adequate blood flow, and the patient even have the Ehlers-Danlos syndrome. It's a condition that you can see the diagram. It will be looser in the connective tissue. It will be highly affecting the connective tissue. And once they have completed draining the chest, they use the same tube to expand the affected lung if it's collapsed. So the collapse leads to atelectasis, so they help to expand the lungs after removing the fluid. And the chest tube is left attached to a closed system and allows fluid and air to escape. So continuous pleural drainage we can quote, and this system can be put to suction or left in a setting wall water seal drainage. And to correctly treat the hemothorax, first we have to address the cause, exactly the cause for hemothorax. And the people with a small injury, chest drainage may be all that is required, and other people may need surgery to stop bleeding. Coming to the symptoms of hemothorax. The symptoms mainly the person will be feeling pain or heaviness in the chest, and they will be feeling so anxious or nervous, and there will be difficulty in breathing, and even the patient may have trouble breathing and breathing quickly and fast heartbeat. The tachycardia will be there, the heart rate will be above 100 beats. And there may be even the scarring of the pleural membrane and lung tissue. So over time this can lead to fibrosis and immobilized ribs. We can prevent hemothorax. So here the trauma, that is the main cause of hemothorax, is trauma, as we have seen earlier. So how we can prevent the trauma better? We have to advise the people to wear the seat belt when driving, or wearing the or even they can wear the chest protection garments when they are involving in any contact sports. Additionally, a hemothorax may cause due to lung cancer. So as we know that smoking is the main cause of lung cancer, better advise the patient to stop the smoking, and we can insist them what are the risk factors and associating factors which leads to lung cancer, so that which reduce the chance of complication of lung cancer such as hemothorax.